How to treat lumps and bumps from under the eyes. Hi, my name's Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about how to treat lumps and bumps under the eyes. The most important thing is a diagnosis. And people get confused between milia and syringomas. Milia are very common. These are usually smaller and they lie on the surface of the skin and they're super easy to remove. As you can see, they do lie on the surface. They're very, very superficial and they're basically balls of skin lying under your skin. Today's video, I'll be showing you how to remove milia at home using a simple 25 gauge needle you can buy from a pharmacist. Now, this is how I do it. I am pretty experienced with this, so I can actually aim towards the eye. I do advise that if you're doing this at home, go from the other direction. So what you want to do is basically just lift the skin off. So I'm actually using this as an extractor together with a exfoliator. So what I'm doing is bevel up. In other words, the bevel of the needle is up, and all you're doing is just nicking the skin. I'm using the flat end of the needle to actually extract it, so I don't even need a combination extractor. So I have my finger, so you can see my index finger placed really on the surface of the skin on the bone to steady myself up, and you can see the needle's really towards the pointy end of my finger, and all I'm doing is just nicking the skin and pulling it up, lifting it up, and then using the end of the needle to just exfoliate. So once again, really superficial. All you do is just nick the skin, give it a good yank up, and then use the end and just push it down. And that's it. All the contents of the milia are gone. Such a simple technique, a very, very safe technique. And like I said, just the little hints like steadying your finger can make a lot of difference. So yeah, a really, really easy, simple DIY at home. It's going to cost you 10 cents to buy. And once you perfect this, you'll be sweet at doing it. So the whole procedure itself should be painless. There should be no bleeding. And like, just follow the rules. Just steady yourself and just practice. Practice makes perfect. So you don't even need to buy any special equipment for this. Okay, so that's my technique. There you go, that's how I remove milia. It's super easy, it costs next to nothing. Seriously, you buy a needle like that, may cost you 10 cents. And just practice at home or get someone to practice at home. So remember those techniques. Simple way to remove milia at home. Now, for more persistent and resistant milia, dermatologists such as Sandra Lee, so remember I'm borrowing this from Dr. Sandra Lee, we use what's known as electrocautery. So for these are bigger milia which are more stubborn. So this is in our office, this is what we do. We normally use an electrocautery. In electrocautery, what we're doing is using a very low wattage, a low voltage, somewhere between 0.9 and 1.1 watts. And all we're doing is we're basically making a little nick on the skin surface using the electrical current. And at the same time when we're doing this, we're actually electrodesiccating, in other words, drying up the milia, but most importantly, creating a tiny little hole of which we can extract, usually with a combination extractor. But once again, every doctor's different. I just use the back of the needle to actually extract it. So hopefully this video shows you numerous ways of which different doctors can perform milia extractions. Now part 2 is how to prevent milia. Now how I approach this is that if your skin can tolerate it, use something like this, which is like a salicylic acid wash. This is a 2% pore therapy by Abaji. So that's one product which I endorse. Other products which I think are great are Neostrata. So Neostrata, you can start off at something like a 10% or Neostrata 10, but you can go all the way up to 15 AHA. So look, if your milia doesn't go with over-the-counter products, certainly prescription creams like this will help. So these are all vitamin A based creams. Tretinoin or some form of retinoic acid will help. Start off with a low concentration and then slowly step up. So remember, treating milia is one thing, preventing milia is just as important. Hey, thanks for watching. Remember to subscribe for more information on anything laser and aesthetic dermatology wise. And once again, to all you guys out there, thanks so much for your support. I can't do this channel without your support.